Welcome to Congress Agorà 2022. We are here with Dr. Patrick Trevidic from Paris. Nice to meet you.
Nice to meet you too.
What are the innovative contents, the confirmation that you want to highlight regarding your participation at the Congress?
During this meeting, we face a main topic that is the lips and the perioral area. We have a few meetings on this because it's now the first demand of the patient, not only the millennials, but also all the range of people from 7 to 70. And we have two different kind of patients who ask for different things. And this topic now is very trendy, and it joins, another thing with this topic is that this is a difficult area to treat because it's a highly mobile area. And so the treatment needs to be natural, mobile, and this is the main point.
Natural,
Yes,
it's very important.
Yes,
Authentic beauty, at least. As for your experience, are there any specific recommendations for your colleagues?
For me, what is very important is what we call the patient assessment. It means you will not inject a male like a female patient, an Asian like a Caucasian one. So the genders, the ethnicity are very important. So the patient assessment is very important. And parallel to this, they will need to have a strong knowledge of the anatomy, the techniques, and the products to give the best outcome to our patient.
The aesthetic medicine is becoming more safer and ethical. Are there any clinical findings and recommendations for patients?
Yes, for the patient, we need to follow first a good consultation. It means this is the first point, the main point for me, because you need to listen to the patient to understand what they expect, not to overpromise, and also to say to the patient what are the limits of our treatment, because they arrive with the knowledge of Google, Instagram, social media, and sometimes you have to tell them that we are not magicians, we have not a magic stick, we have needles, we have device, we have surgery, but sometimes we can't achieve what they expect. So we need to be very careful because at this time people think you can reach everything, but it's not true.
It's not true. And the social medias are like that. They can create a very big illusion.
Exactly. With Photoshop.
The doctor must be a psychologist too.
Exactly. There is a psychological dimension, very important.
Let's talk about patient. Patient, not client. The relationship between doctor and patient has changed over the years. How did it change?
It changes because the patient changes, the doctor changes, and the world is changing. So we are not doing the same technique than we did 10 years ago first. So we change our way to treat the patient. But the patient also changed because he's not a client for me, he's really a patient. You have to stay on the medical side. It means you will not inject everywhere, you will not treat everything, because if you do that, you will do some mistakes, and so the patient will not be happy. So the patient change also because he receives a lot of information. Some are good news, some are fake news, and so you will have to do something to explain to the patient very clearly before you will do your treatment what you are going to do and what they can expect from you. This is very important in my point of view.
And I think that it's much easier to say yes than no, because it's no, you have to explain why not.
You're absolutely true at 100%. Say no, it's very difficult sometimes, but the patient always like when you know how to say no. You understand what I mean? Because you have to say no, but to explain why you say no. And with my patient, I have 30% of the patient that I will never operate or inject. Why? First, for technical reason. I have not the technique to achieve what they expect. So in that case, I cry with them and I'm looking for the future in such meeting. The second point is when a patient arrives and the psychology of the patient is not good. In that case, I prefer to let this patient with a psychologist or on the psychology side than to do a treatment, and the patient will never be happy for psychological reasons. So this is the two reasons, main reasons, why I say no to a patient.
Thank you, Dr. Trevidic, for your important contribution, and have a nice day.
Thank you, you too. Bye-bye.